Once this ends, let the games begin, because that is when they are going to vote on repeal and replace. Remember, they need 216 votes. It means they can only lose 21 Republicans. We have learned that the Freedom Caucus has come over to their side of things. So this may indeed happen. Of course, then it will go on to the Senate. But is this really going to work? Is this the kind of program that we need in place? Former Lieutenant Governor of New York, Betsy McCaughey, Republican Strategist Ford O'Connell, and American University in residence, Capri Cafaro. Good to have all of you guys here. Absolutely. All right, I guess I want to start with Betsy here because, I look at this and I still think there's a whole lot of problems with it. It's not perfect, and I know it's going to get reworked and it'll look different when it gets to the Senate. I know you like things like the 3.8% tax surtax. That's going to be taken away. That's good news for investment. But, I want to get to this pre-existing condition thing here, because this is what people are taking issue with. Why are taxpayers going to be on the hook for people's pre-existing conditions?
Because everyone in America seems to agree that people who have serious illnesses and pre-existing conditions, serious health history problems, need help in paying for insurance. Otherwise, we're back with Obamacare. Here's what happened. Obamacare tried to force healthy people and people with very serious illnesses to pay the same premium. But the fact is, as the Aetna CEO pointed out, 1% of his subscribers under Obamacare, the very, very sick, used up 44% of the health care. So trying to sell health care to sick people and healthy people at the same price is like trying to feed a Chihuahua and a Great Dane on the same budget. The healthy people refused to buy because they knew that all of their enormous premiums and sky-high deductibles, all of that money was being extorted from them to pay for somebody else.
Okay.
And they weren't getting it.
I hear you, and that makes sense.
So
I understand why companies,
right,
because somebody's got to. I hear what you're saying. I guess this is one of these things that is just incredibly difficult to solve. Let's face it. I mean, otherwise we would have had a better system in place by now, where everybody was being covered and we were still offering really competitive care. But we don't have it, and we're trying to come up with some ways here, some creative ways to fix the problem. Capri, they're talking about adding an additional $8 billion to the existing fund, roughly bringing it so around $130 billion that they would have to cover people with pre-existing conditions. This is taxpayer money, government money that would cover these folks. But I don't know if it's enough. So I'm not saying we'll let you get back in, but I'm not saying that I even like the fact that taxpayers are going to have to cover people with pre-existing conditions. I don't know what the right answer is here, but I am concerned that we don't have enough money to begin with.
Right, we have actual data in regards to high-risk pools. What this money would do, essentially, because the bill eliminates Medicaid expansion, and then it essentially, for lack of a better term, it doesn't block grant, but it takes away the formulaic allocation of Medicaid money in the way that it's currently structured from the federal government to the states. This is an absolute shift of tax dollars away from essentially the system that is currently created, and it's there now subsidizing those in a quote-unquote high-risk pool. Now, here's the problem with it. It isn't enough money, and what we have seen in previous high-risk pool models is that it has not necessarily been effective in the ability to meet the needs of these individuals. The other challenge under the AHCA is the way that the premium support is structured, because those individuals with pre-existing conditions, those that are older, are going to end up paying potentially like $26,000 of out-of-pocket cost.
All right, I want to jump in there just to clarify. So right now, the way it exists, insurers can charge older folks up to 3 times as much as they can charge the younger folks. Now, that's right. Under this new plan, they can charge up to 5 times as much as they would charge the younger folks. But, the competitive argument in this, and I think Betsy would argue, and Ford perhaps as well, is that if you're the insurance company, your older folks are going to need more in the way of insurance. That is true, so
but that money isn't going to go far enough. That's not going to go far enough, because even though their care is going to be more expensive, yes, the amount of money of subsidy that they're going to get is still not going to be adequate to meet the needs of that higher cost. That is part of the issue. It's going to take people out of basically the marketplace. They're going to lose coverage. And the other part of this, too, has to do with something called the community rating, where, right now you're you can't charge individuals different amounts for their premiums if they're in the same region.